Cleft lip and cleft palate are among the most common birth defects. They most commonly occur as isolated birth defects, but are also associated with many inherited genetic conditions or syndromes. Joining us for more on this is Dr. Wale Akinlade, a consultant oral and maxillofacial surgeon. He joins us virtually. Hello, doctor. Thank you for joining us today.
Thank you for having me.
All right, now talk to us. What are cleft lip and cleft palate?
Between your lip or the gap exists on your palate, then you have a cleft lip or a palate. Beyond that, it's that this cleft lip or palate typically occurs on the upper lip, and most times it might come in as a combination of the lip as well as the palate. Sometimes they might stand alone, they might just be on the palate alone or on the lip. And in some instances, there might be two gaps on the lip, and in some instances, there might just be a single gap on the palate. So in the true sense of it, for our lay audience, we perhaps we just call it a gap that is present on the lip or on the palate. Now, the thing about this clefts is that they are typically formed before a child is born. So most children that have them usually would have them around the time that they are born. So the child is coming out from the mother. The child usually presents with this congenital malformations, as we call them in our palate.
From what you said now, I'd like to know, can this be detected before birth?
The truth is that given the advances in technology that we have now, there have been inroads into various forms of diagnosis of cleft lip and palate. And the truth is that in the true sense of it, in many advanced climes, you have scenarios where this can be diagnosed in the form of ultrasonography. Ultrasonography is more or less like a diagnostic method of assessing the state of a child within the womb of the mother. Usually women do this within antenatal care. Around the third trimester, that's between the months 6, 7, 8, and 8 months, is typically a way of assessing whether a child will have a cleft or whether a child will not have a cleft within the mother. And this is usually done using 3D or 4D ultrasonographic tools.
Okay, talk to us about the causes then.
That's the typical question that virtually all mothers would ask me as a doctor. Even by the time we are done treating patients, we are told that we are asked a question. I think it's a fundamental question: what causes cleft lip and what causes the cleft palate? For the most part, we could describe risk factors that cause them. However, to say a particular thing might cause it might not necessarily be the right pointer to say. Let me expand this a bit. So we say there are genetic causes, then there are environmental causes, or let's say environmental risk factors. Genetic will be that if there is within the lineage of a child, people that may have particular genes that might cause cleft, then there's a tendency for a person to now have a phenotypic presentation of those clefts. In other words, it occurs within the gene, but then it presents physically as a cleft. But then this might have been something that could be inherited. For environmental factors, on the other hand, a myriad of reasons have been given, but the more common ones might be the use of alcohol in pregnancy or the previous use of alcohol. We might also want to talk about conditions like the rubella virus, There are also conditions like exposure to radioactive agents, amongst a few other causes, as it were. But the truth about cleft lip and palate causation is that it's a mix of various factors, genetic and environmental, as well as epigenetic factors, all coming together to form an environment where a child ends up having a cleft lip or a cleft palate or a mixture of both.
Well, I do not know if it would be okay to ask you what the symptoms are, because I believe that this is something that you get to see. When you see the person, you notice it. So talk to us about the presentation.
A child that has a cleft lip, it's obvious because the first thing that we usually see when we have the child is that let us see the face of the child. So you obviously will see an anomaly on the face of the child. The anomaly will present as a gap on the lip, and the gap continues to even the floor of the nose. But in many instances also, you might have scenarios where a child might present with what we call an isolated cleft. Once a child has an isolated cleft, typically occurring in the palate, most parents do not know that the child has an isolated cleft. So you would notice that when the mother begins to feed the child with breast milk, the child doesn't seem to take enough as he or she ought to take. In some instances, we have regurgitation. Regurgitation would mean that once you take in a meal, it comes out from the nose in certain instances because there is a direct communication, and that is why that occurs. In many instances also, we have seen mothers say that they give their kids food and they don't seem to be taking a lot. So most of the time we look at the mouth of the patient, and then we look at the mouth of the child, and then we're able to check the palate and see that there is a gap within the palate there. So in the true sense of it, the presentations are typically clear, but you have scenarios where they might not be typically obvious as a result of not being professionally trained to see it, and that is where we come in. Facial surgeons into the mouth of the patients might be, and then carrying out the treatment as we ought to. But more importantly is also the aspects of psychological counseling, and also before we go ahead with the treatment of such children.
All right, now that we are talking about the types, apart from the isolated cleft you just talked about, what about the submucous cleft palate? Are they the same thing? Talk to us. Let's understand.
Isolated cleft palate or isolated clefts are not the same as submucous clefts. As the definition, the submucous clefts are clefts that occur beneath a normal surface. Isolated clefts, on the other hand, are clefts that occur within an anatomical structure of the palate or of the lip, sometimes affecting a particular subunit of the palate or the lip. When we say subunit, we're talking about the lip having a nasolabial element, a nasal as well as a lip element. So an isolated cleft might just occur on a particular part of the lip or on a particular part of the floor of the nose. But typically, most isolated clefts occur around the palate. And in this sense, they occur around the soft palate. Typically around the uvula area is where they are. So you have a scenario where you have a palatal cleft or a fissure of the palate and an opening of that part, which might not necessarily be present on the hard palate or on the lip, but just on the soft palate alone. So that's an isolated cleft of the soft palate.